Well, good morning, good afternoon, wherever you are. It's great you could be with us again today. So we've got our weekly quick update of sentiment from the Longwoods travel sentiment study for COVID-19, which we've been sponsoring over the last quite a number of weeks now. And this is wave 7. So it was in the field. You can see there April 22nd. A sample of 1,000 adults. My name's Chris Adams. I look after research and insights. And again, I'm delighted to be joined by Amir Elon, who's president and CEO of Longwoods International. I'll pass over to Amir just in a moment. Just a reminder, we've got our COVID-19 portal and communication center, including all our upcoming webinars, data points from a variety of our data and research partners, and all sorts of other practical resources right there at that web address. And we, in addition to this quick summary and the slide deck that you can download, you can also get just a 2-page quick summary with 4 data points analysis, again, right off our website there, and also off Longwoods. So without further ado, I'll pass over to Amir. Amir, what are we seeing this week?
Well, thank you, Chris, and good morning, good afternoon, good evening, everyone. This week we've seen more stabilization, but also a few changes, and we're going to talk about that here real quickly in the next couple minutes. First of all, we've kind of stand steady here with 82% of travelers planning to travel in the next 6 months, having changed or planning to change their travel plans due to the coronavirus. As you can see, it's been pretty consistent. About half have canceled a trip completely, just under half reduced their travel plans. A lot of the travel plan reductions are changing from flying destinations to drive destinations. So the road trip coming back here when it's okay to travel. And of course, anybody who's pretty much had international plans or other travel plans, they've been impacted by it. The changes have pretty much happened here for the short to midterm. Moving ahead, as we're looking again, as I said, stabilization is we've seen this pretty consistently now for about the past month in there, and people have been impacted, and so be it. In terms of, again, all the key factors we talked about, we've seen these holding steady for the last few weeks. Not as bad as it was in terms of earlier in the crisis, but not much movement in planning. And again, I call attention here to the opportunity for road trip to resume pretty quickly here once things start releasing. Moving on ahead, this is something interesting we've seen. As you know, you've been following this every week. We've been asking about the key factors that would impact the decision to travel. Transportation costs are still, gas prices at an all-time low, and obviously you can get a good deal on airfare, et cetera. That's not really factoring in. Concerns about the economy is still held steady. Again, I think until people until people start overcoming their fear of COVID, the economy factor is not going to really factor in there very much. What it is interesting to note here, and I'll change the next slide, is that over the past month, we've seen that those feeling that they'd be greatly impacted by the impact of COVID-19 has begun to inch downward. You see about peaked at about 67% about a month ago, and it's now down to 61%. So we're seeing that moving in the right direction, so to speak, in there. Now, again, the last couple of weeks, I've been able to report with a little bit of joy that we saw a reversal in the direction of intent to travel. We bottomed out at 65%. And it got as high as 72%, and now this week we come in at 69%. It's flattening a little bit. Now, there's always a 2-3% margin of error, so it's kind of what we're looking at is the last 3 weeks as a whole, and we're seeing stabilization there. Now, one would have thought with the opening up, the discussion of opening up more states and the initial plans, as some states at this point have begun to open, you would see that intent to travel start inching up. However, if you've been following the news media and the messages, and you've seen some other national polling out there, folks are hesitant about opening up too soon across all areas, and that's trickling up into travel. So despite the fact that we have nice pent-up demand to travel, this is kind of unprecedented. We've got a pushback about fear that travel will cause a resurgence of COVID or getting personally infected. So this is something we're going to have to watch very carefully. And as destination marketers, are going to have to think about that. And then last but not least, we add a kind of a wild card question every week. This week, we asked the question, it's time now, ask the question, what are the cues that are going to indicate, what kind of information is going to make the traveler feel it's safe to plan their domestic trip? Overwhelmingly, American travelers told us that it's going to be official advice coming from the highest federal level, like the CDC or government health experts. As you can see, well ahead of elected officials, leadership, or even local state government officials, and so forth. And at the very bottom there, you can see the deals and attractions and so forth. You're not going to be able to, quote unquote, market your way into recovery from that perspective. It's got to be the health officials first that conveying that message before the traveler is going to feel safe to consider your destination, attraction, etc. So that's my story, and I'm sticking to it this week.
Thanks a lot, Amir. And I think that reinforces the fact that this is a health-driven crisis, obviously, and so we need to look for the health indicators around the trajectory of the COVID-19 virus in our communities and across the United States and then internationally to help guide us on when it's appropriate to travel and when, frankly, it's appropriate to market travel. So, I mean, that's really the sort of key insights from this. We've got stabilization. People are in a sort of waiting room, waiting for clearer guidance. So visitor-related communications are not going to be credible or even, frankly, appropriate in the absence of this official advice. It'll do probably more harm than good, apart from, obviously, the very considerable safety issues around it. And so we need to elevate and sort of highlight this official advice, work alongside the authorities in terms of social distancing, etc. Advocating, of course, in our own businesses or destinations for testing, tracking, tracing, and even things like cleaning and hygiene standards that are going to be important to communicating that sense of safety, which is going to be a critical outcome coming in the recovery. So again, all this research is available on either of our two websites, and actually Amir is going to be joining us next week, the 5th of May, Tuesday, 3 p.m. Eastern Time, and he's going to give us a quick summary of the last 8 weeks of research, and we'll also be joined by Laura Alto, who's CEO of Helsinki Marketing, so we'll get a Scandinavian perspective on the crisis and how they're responding. Thanks again for joining us, and we look forward to connecting with you in 7 days' time. Thanks.